She's like pulling her hair out. She's ripping her hair out.
What time is dinner?
7 p.m.
Where?
Honchos? Honchos.
You sent the email back saying dinner. When the two of you accept dinner, do I have to send the calendar invite?
I want to get on film for this one. She does a fantastic job managing our lives. She's going to do a great job for you.
I believe there was a clip when we were going to Florida, and you says, "Yeah, Becky's your only support system, and she's gone. I'm winning her over my side."
Yeah, you're done.
You're cut off.
Well, Craig, you better be fat. Oh, he's lanky. He's so lanky.
My name's Dr. Chris, and I'm an interventional radiologist.
Hi, I'm Dr. John, and I'm an interventional radiologist.
Interventional radiology is doing minimally invasive surgeries using image guidance.
We do several procedures through small incisions with local anesthetic. We do it usually in an office-based setting. We keep patients out of the hospital and get them home as quickly as possible. I don't know how you got past me in the hall the way you did. It was incredible.
Come on, what is it? 5-time hockey.
I was like this. I know, I was like this. I was like, how did he just get
Let
past
me get
me?
it straight. 5-time
Team captain. Very articulate.
captain
Yep.
for the Niagara.
4 times. 4 times.
No, you said 5. A priest told me, of course I believed it.
It was 4 times.
On a more serious note,
Yes.
Go ahead.
I wanted to talk about the fibro commercial.
So we have to talk about the fibroid commercial. It's not my favorite. Commercial has to come out of the commercial. It's probably because I see him every day. I understand when he makes weird faces or has a strange tone to his voice. It's very challenging for me to watch. It's an incredibly serious topic. I know how serious the two of you take it. I think it's already a bit intimidating for women to come in and speak to the two of you. You're young, you're attractive. It's
She said,
don't get that on camera.
That's on camera. That's on camera. She said
I'm
it.
polite. I'm just trying to be polite.
Burn!
But I want women to be able to feel comfortable, and for whatever reason, having him say menstrual period is harder for me to listen to than it is when it comes out of your mouth.
If you're having heavy menstrual periods, having a uterine fibroid embolization at Great Lakes Medical Imaging is a great option.
Menstrual period.
See, sounds more clinical. But when you watch it objectively. If there were any commercial that we wanted to represent the brand in a far more sterile clinical way, which is a little bit different than I think how we normally want our brand to be perceived. In this case, I think it should come across that way because from a female's perspective, I think it's already such a sensitive topic.
I'll go watch it.
Okay.
And I will come back to your office later.
Okay. We've worked so hard to build this brand, and now it's going to come to one fibroid embolization commercial. That stupid grin he's making. I can't do it with a straight face, and he says it with a smirk.
But that's one of the symptoms of fibroids, though.
I can hear a lot of people say,
Yeah, but if we cut you out, then there has to be a clip of somebody saying menstrual period.
What if I say it and he lips it?
Yeah, let's try it.
Menstrual period.
Here's what I'm going to say back. I think Chris's part looks great, but Marshall's part is a bit awkward for me. Just all of Chris and do a B-roll of Marshall promoting IR
that's what I
at
think.
the end.
All jokes aside, I think this will work actually for the commercial. I did my own cut.
You're having heavy menstrual period. Don't listen to his opinion. He's off on left field right now. The other thing is that the angle that you're coming in at my face, I don't think I've ever looked that frumpy.
Are you sure you don't want to scratch a little bit? It's really satisfying.
Wait,
Would you
I do. Oh, I'm there. Yes,
That's a funky scratch.
Having heavy menstrual period.
early. I'm not.
Get me on here. Get me on the camera now. We're here at Great Lakes Medical Imaging getting prepared to do our uterine fibroid embolization in our office-based lab. And we got very beautiful Becky Peckham here. It's very early in the morning. Just take a look at Becky. She's drooled multiple times. That's why she has that scarf on. The scarf is to catch the drool.
It's to cover the drool. I don't even know what I'm wearing today. Like, I got up and I had an outfit picked out. Too much.
You laid it out the night before and didn't have the energy to put it on.
We gotta get her some scrubs.
I'm so jealous of you guys. You get to wake up and just pull the same outfit.
We essentially wear pajamas to work every day.
Yeah,
I love that you wear a fanny pack. I want to get you a pair of the zebra print pants.
The hammer pants?
That
yeah.
bodybuilders would wear.
Yes.
I want to get you a pair of those
I would
with
totally
your
rock
fanny
those.
pack.
100% I would rock
I think
those.
they look phenomenal on you. Oh, look who it is.
Hi, how are you?
Oh, hey, Barb.
We're all ready for the case.
What time is it?
It is almost a
It says
quarter to.
7:43.
Should I bring the patient over?
Yeah.
Yes, Barb. Please.
Oh, anything for you, doctor. I'll be right there.
Why are you hamming it up for the camera, Barb?
Why not?
She has a radio voice. Anything you need, doctor.
We're gonna introduce the vlog like Barb. Welcome back to Great Lakes. Focus, John.
Becky's laughing already.
Hi. Welcome back to Great Lakes Medical Imaging.
How are you?
I'm Dr. Chris.
And I'm Dr. John.
And we'll see you in the next case. Wait, that's our outro. Welcome back to Great Lakes Medical Imaging. We're here doing a fibroid today. I don't think we've showed them a fibroid yet.
No,
You
it's
saw
the
our-
fast one for the first cut.
I don't think we've actually done a fibroid case on the vlog yet.
This is the first one for the vlog.
Yeah. So you've seen our commercial. I think episode 1, we started with the commercial we were shooting to get the fibroid clinic off the ground. So we're going to show you actual case here today, and we'll take you through it.
Pretty exciting case, actually. It's a patient who her lifestyle has actually been pretty profoundly changed by the fact that she's got a large fibroid in her uterus. So she finally decided to come to us. She doesn't want to have a hysterectomy, so we're going to try to get her a great result.
Heavy periods, back pain, not being able to go more than an hour without going to the washroom just because the fibroid pushes on the bladder. Like she's up multiple times during the night.
In addition, because her fibroid is so large, it's causing a blockage in her kidney, and I think it's probably compressing some of the veins in her pelvis, and it's resulting in swelling in her lower extremities. So we're obviously going to watch her very closely because she may need a hysterectomy at some point, but if we can get her past the hump and get some of these compressive type symptoms relieved with fibroid embolization, we're going to do it.
Exactly. And having a uterine fibroid embolization doesn't preclude you from having a hysterectomy later. So why not start with the least invasive procedure and then work your way up as needed.
Well said. Let's go.
To use a long catheter because we're going from the wrist all the way down to the pelvis. So.
Ultrasound up the arm to make sure there's no radial loops. We've got a pretty straight shot all the way up to the brachial artery. So first step is getting access. So we're going to access the radial artery. I'm going to inject some local anesthetic first. This will numb up the soft tissue so the patient doesn't feel any pain. We're going through the radial artery in the wrist. Okay, you're going to feel a little pinch on 3, okay? 1, 2, 3, a little poke, and freezing going in. So the wire's going smoothly now inside the artery. So like most of our procedures, needle, wire, sheaths in place. Radial cocktail, please. The radial cocktail is a combination of drugs that prevents spasm of the artery. What we'll do is I'll dilute up our cocktail with blood to 20 cc's and then re-inject it slowly. Here's our catheter, through it goes a wire. Don't breathe, don't move, don't breathe, don't move, don't breathe, don't move. Don't breathe, don't move. Okay, breathe normally. Well done. So these are the particles here, the embolics. You can see them. You can see contrast is denser than the beads, so now the beads float on top. Add some saline, which is lighter than the beads, and then the beads will hopefully distribute evenly in our solution. And we're just going to diminish them to block off the arteries that supply the fibroids. Agitating the particles to mix them up in even solution, or I guess suspension would be a technical term. The more particles that get packed in, the slower the blood flow becomes until eventually it'll theoretically stop. So as we inject more, we have to inject slower.
I love him.
2 things I can't believe you said to him.
Love him more than words can describe. In hands of a god.
His hands of a god.
Did you get that?
I did.
Oh, perfect.
Can I look at that?
So we finished embolizing on the left side, so the arteries supplying the fibroids are now blocked off. I've pulled my catheter back and I've gone into the other side, found the other uterine artery.
Yeah,
and
he did it all, whole thing.
it was a team effort.
He's always trying to steal the spotlight. What else is
When we inject contrast, you can see the opacification of the large fibroid here. Now we're going to embolize the right side. The large fibroid uterus has stained now, looks darker because of all of the particles that we put into it. There we go. Any questions? Comment box below. This is Rebecca Peckham, Becky Peckham. This is actually my wife. She is the brains behind the vlog. She films pretty much everything. So you guys have maybe seen her.
Are you talking about my fanny pack?
Okay, put your fanny. Oh, you have a fanny. Yeah, put your fanny pack on. You gotta get this on.
This is my fanny pack. Okay,
Yeah,
I
so
keep my batteries in here, so when I'm running around filming these jokers, I have batteries. On
You
my
have all
hip,
your- you have your
at the
lens.
ready all the time.
You may think that is in style. It's not in style anymore.
my God.
You're so extreme.
You're gonna rock a fanny pack.
Okay.
You gotta be extreme.
Filmer extraordinaire, a little gift from Dr. John and Dr. Chris.
So I actually almost ordered this, and I was like, I don't know if I could wear that at work.
Did you actually almost order it? Gary was like, you need to get her the fat belly fanny pack. I was like, what are you talking about?
It looks fantastic. Can you sit down?
Oh my gosh.
And there's another compartment in there. Do you see that? There's
Compartments
two
on
compartments upon compartments.
It's truly hideous. Oh, show Barb. We go.
Go show Barb this.
That's great.
I think that, if you do a little like manscaping, it's going to help. I do know a few places we can go. Oh, wow. Love it. Love it. And then, wait a minute. I think it even has,
Some lint.
some little lint in
Perfect.
That's disgusting.
that is.
Just a token of our appreciation.
I appreciate it. Thanks, guys.
We're actually filming a segment with Western New York Living today. I have no idea what to expect. Dr. John and me are going to do it. Spin to the studio. And here we are at Channel 2 News. Is it Channel 2 News? Here we are at Western New York Living. We have to find Dr. John. I have no idea where he is. Perfect.
Are the doctors here yet?
That's me.
Oh, okay.
Nice to see you. It's John.
Hi, Anne-Marie from Great
Anne-Marie.
Lakes. Nice to meet you.
Hey, Becky. Chris looks beautiful, doesn't he? Don't you touch me.
He changed his hair.
I'm gonna say something real nice on air about you. Just
you
wait.
really?
Do you like the new hair or no?
I do. I love it.
Is it okay?
Yeah, it's great.
He loves it.
It's fantastic.
Great to see you.
Don't touch me. Don't touch me. I have not met this person, but I saw your segment before.
Yeah, it was super awkward. I think we should talk about veins and fibroids.
Well, they said the fibroids are going to be the main thing, but I think the only.
Besides how fabulous I am,
Have we
come back.
introduced? Are you going to ask what her role is here first? Like,
And we talk about what your role is. Look
I
into the
am-
camera.
I am Vice President of Business Development. I'm in charge of everything that happens outside of the building. So it's my responsibility to make sure all referring doctors, nurses, PAs know all about our organization and
Understand
these
how
two
awesome
lovely
Dr.
guys.
Chris and Dr. John are. Thank you so much.
Absolutely, and I talk about it all the time, how
She is-
amazing they are.
there's many layers to her
She
career.
is the light of everybody's day, and I actually mean that. It's not sarcasm. It's actually the truth. So
Excellent.
we love her and appreciate her. She's the
Thank
best.
you. I'm out.
How come you're standing closer to her than me? You're
Becky,
fired.
I was talking to Chris the other day. If you ever notice that the camera is shaking, like right now, it's because Becky is behind the camera laughing and crying.
It's always a good day if I'm crying.
It's not pure. There it is. You're not. I looked the one day I was looking at you. You were wiping
crying?
tears out of your eyes, laughing at that Becky. She's crying by the camera right now. That's what's so funny about that.
Get it together, Becky.
These guys are hilarious. My eyeliner's running all the time.
Did you get a haircut specifically for this? Because I feel like you did.
I neither confirm nor deny that. But the question is, did you get a haircut?
I did not. I just combed it back. It's like I have like two options, either straight forward or straight back, and
Like-
both options are bad. So
And like, really channel that Ryan Reynolds from.
That's
He's
it.
from The
Yeah.
Notebook.
That was Ryan Gosling.
Same thing. They have the same name.
Obviously, probably going to be subscribing to our channel soon.
Obviously, yeah. Like if you guys haven't, get at us, Ryan's.
We're at Park Club Lane.
Uterine artery embolization or uterine fibroid embolization. But all it is a fancy word meaning we'll block off the blood supply to the fibroids and in turn they'll shrink.
We do the procedure in our outpatient facility. They're at our facility for a few hours, and then usually within a couple weeks they've completely recovered. Versus major surgery, which can take months to recover. Chris, I just want to say I thought you looked beautiful on camera. I mean, you were striking. Look at him. He's made for TV. Look at that hair. I mean, it's perfect hair. It's incredible. I wonder how he's going to feel when he sees this footage afterwards. He was very good on TV, don't you think? He was good. He was phenomenal.
I think you guys did fabulous.
This is the first appearance on TV for Dr. Chris and Dr. John.
You guys did fantastic.
If you like the video,
there you go.
subscribe, like it, subscribe, share it around.
Share it, family, friends, like even people you don't like. Dr. Mike, we're coming after you. Thank you. That's right.
I'm Dr. Chris,
And I'm Dr. John.
and we'll see you in the next case.